Hi everyone, this is Stefan, and this is the third installment for the Statistics Legends for the SASA newsletter. Today we have the pleasure to have Sheetal Silal, or Professor Sheetal Silal from UCT, and I'm so happy to have you here on this little platform of mine.
Hi, Stefan. Thank you so much for having me on the platform.
I just want to let you know, for people who may not know who you are, into an LLM, I just entered, give me a name for statistics and disease mapping, and your name came up. So I think that's, does that basically sum it up?
Yeah, I guess so.
Okay, so I think the LLM was quite accurate there.
Yeah, glad to see they're working.
Yeah, it's good. It's quite gives you a peace of mind that they're not talking nonsense. Okay.
Yeah, no, credit to our statisticians.
So thank you so much for being here. Usually we start these kind of talks with kind of where you come from, because looking at where you are now, I went to look at your undergrads. You studied quantitative finance, and then you did operations research. So can you take us a little bit back? What was undergrad like, and how did that transition go about into your PhD?
Thanks. I mean, I think it's actually really important because what I studied, it seems all these different things, but they really came together to define my research and my professional career. So at the time that I was choosing a university degree in 2001, all the clever kids were told to do mathematics. If you like mathematics and you like problem solving, do actuarial science, so a form of quantitative finance. And I went studied that, but I got really bored. What was nice about actuarial science, though, was that I learned the finance, which was excellent. I learned economics, also great. I had a strong foundation in mathematics and statistics throughout the degree, but the corporate life and even just the actuarial aspect of it didn't appeal to me at all. And so I came across the field of operations research in the stats department at UCT. And there we were using mathematical and statistical techniques to solve real world problems and support decision making, but in a way that really affects people's lives and day-to-day decisions. And it drew me immediately, and that took me into, with the sort of stats honors, moving straight into operations research speciality, but never losing my losing touch with the statistics. And in operations research, when it came to now choosing my dissertation, Professor Francesca Little, who was my master supervisor, she gave me a paper about disease modeling. And I was like, what is this new thing? Oh, we can use mathematical and statistical techniques to actually solve public health problems. Wow, that's amazing. And so that's basically how I got into this field in about 2006 and never left.
Okay, so I like that because you have to hit a few, like, let's say it's cornerstones where you turn towards where you need to go. And having that finance background still helped you in today's, or where you are today. I also started finance and I also didn't really enjoy it. Not because just because I think I'm terrible at finance. So in this journey, who were the people? You mentioned now Francesca Little, legend. Were there other people also that helped you to, because mentors are super important, right?
Yes.
That helped you to put you on your path. So who were they? Was there a pinnacle point or moment other than when she handed you that paper?
Yeah, there was one defining moment from one person who really, I think, saw my career from beginning to where we are now. And that is actually a previous president of SASA, and Professor Theo Stewart, the late Professor Theo Stewart. He is the person who, whilst teaching me third year statistics, introduced me to operations research. and helped me see my journey through that field, through my master's and PhD, and my career as a lecturer at UCT. If I were to highlight one person who helped to define my career and help me change from a degree that I wasn't too happy in, actuarial science, and pivot into something that really was meant for me, that is Professor Theo Stewart.
Okay. Bit of a side note, it's just funny how many of us have this journey of where we start in actual science. We should really thank actual science for bringing us all here.
I guess that's a nice positive way to look at it.
I think it's quite nice. So, because a lot of times, especially from Professor Stewart's point of view, those people, they don't really know that they're making that impact. For you, it's this astounding moment. And for them, it's just perhaps another maybe like minor or kind of student interaction. And now that you've also started supervising a lot, and you have, you're the director of MASHA, do you enjoy that aspect? Is it the interacting with the students? What does that mean to you in general?
Thanks. So that's actually a very large part of what we do at MASHA, the Modeling Simulation Hub Africa here at UCT. MASHA has been leading capacity strengthening on the African continent in the space of infectious disease modeling. And so right now we've received an award from the Gates Foundation to train 13 PhD students in disease modeling in Africa. And many of these students are going to be the first modelers in their country. So it is a huge contribution to supporting public health decision making on the African continent. And we were in the fortunate position to help design the efforts to increase capacity strengthening. So because of the excellent mentorship that I've had in my career, it's the importance of it in delivering PhD training and postgraduate training that is well-rounded and has that teaches one both soft and hard skills and skills to flourish in the real world and make an impact. Those are really characteristics that I value and embed in my postgraduate programs.
So you're a very busy person. So supervising 13, obviously, are you involved with all 13 PhDs in some extent?
Yes, I am actually involved in every single one. We have supervisory teams for all students, but I am the main supervisor. And I dedicated 1 year of their 4-year PhD program to do training with them. Now, in South Africa, our PhDs are research-based only, without any coursework, but I offered an extra year of coursework so that these students could learn the field of disease modeling that was delivered by myself and other experts that I brought in. The field that I am in, infectious disease modeling, is still very niche on the African continent. The capacity is very low, and for a long time, I was the only malaria modeler working in policy on the continent. And so when designing this program, it was imperative that I had to play a leading role and immerse myself in the training of these students.
So you mentioned policy. We're going to get to that in a moment. But so for prospective candidates who want to apply, or what are certain things that you look for in applications, or what would you tell people who are interested in this? What is the drawing factor, or is there also maybe a point where you would say maybe this is not for you, or can you elaborate a little bit on that?
Sure, certainly. And I'm very particular about that. So this field of supporting public health, it comes with its own challenges. We do not have academic data sets that are perfect, that are ready made for you. We do not have clear defined problems to be solved. We know that there are health crises. We know that there are epidemics, that there's uncertainty, and there are poor data sets. Right? There's a lot of data, but sometimes very little information that can be gleaned, or a lot of cleaning and preparation to be done. And in some cases in health, we're not quite in that big data world. We're still in the no data world when it comes to health and understanding disease. So what I look for in students is not just strong technical abilities in statistics and mathematics and programming, but I look for a desire to support something larger than oneself. And that is the hallmark. This is doing a PhD with me is not in MASHA. The work that we do is not about getting a degree or any problem you work on with us is about supporting a population in need, supporting a government to make a better health decision. And so you need to be prepared to work with these, really sometimes awful data sets that you're going to have to gain as much information as you can. I'll be prepared to deal with uncertainty and how you have to leverage sometimes, local expertise and qualitative data to help understand and contextualize what you're trying to do, how you have to sometimes work in a world of complete uncertainty, like in the COVID pandemic. Here we were asked to model, a disease that was new to the world, in which, very little was epidemiologically understood. So that's what I look for. I look for something that where a person is willing to do an analysis and to use their skills for something more than their own growth.
Sounds, if I have to put myself in your shoes, that sounds very challenging. Because let's face it, I mean, our students are technically very strong.
Yeah.
But in undergrad and, postgrad, where do they ever really get their hands dirty with very iffy data sets? And, where do they possibly build that drive to, solve real world problems? And so we can maybe talk about this a little bit later about, with keeping this in mind, how can we tackle this in undergrad already, maybe?
Yeah.
Not to give students just that perfect table of a complete data set, but to really, challenge them, not just with the technical components, but also with the life components, the data components.
Yeah, but just to add one point, Stefan, before we move on, I'll give you an example. When recruiting students to my PhD program, they each had to write a letter, a motivational letter with what they were going to do with this degree once they went back to their home countries. And so like they understood what, disease modeling was and the difficulties and uncertainty in this area. They had not themselves worked with large and messy data and so on before. But the question was what was their vision? Did they want to do? How did they want to help? And even for my master's programs, I run a data science internship or fellowship program, and we can talk about that a bit later. And even there, we ask for a motivational letter as to why you want to be working in this public health space.
So before we get into that, let's quickly, because not a lot of statisticians in the country, I think, work directly with policy. So how did that start? Or were you first approached by government, or was it, can you highlight a little bit as how that process went up?
Yes, it's always a little bit of both. It's about you making those in decision-making positions aware of what your skill set is, and it's about them also coming to you with problems. So my PhD was in supporting malaria elimination in Mpumalanga province, and it was working with the government departments in Mpumalanga, but it wasn't really in support of decision making because I was learning how to do modeling. So a 3-year time frame is really not the major decision making window to be useful. So it was understood that I had a good relationship with the decision makers there. Following my PhD, I had taken on some very larger projects in the Asia Pacific to develop malaria modeling investment cases and so on. And when I came back to South Africa from a research trip, I called up a government member who was in charge of malaria at the time. And I said to him, "Hi, do you have time for a meeting? I'm flying through Pretoria, through Johannesburg. I'd like to come show you what I can do." I mean, those were honestly my literal words. Sounds a little cocky, I think, but it wasn't meant in that way at all. It was just like, "I'd like to show you, some of the stuff that I've been working on, and I think it might be useful to you." So he had a moment, and I met him, and I showed them this is what modeling can do, how it can support decision making, and together we formulated a problem that we could be solving, and a project that then lasted a year. And that was where I had the first type of major policy impact that due to our analysis. In fact, we developed an investment case for the malaria elimination in South Africa, which involves estimating the funding gap that would be required from the interventions to reach malaria elimination, and how much they would cost, looking at the budget that is available, and then determining how much money you would need to still fund the programs. But taking it one step further, that you were working with, the modeler, me, was working with government to take this model-based insights forward to National Treasury to ask for that money. So I went with the government partners all the time, sitting in meetings with National Treasury, sitting in meetings to say, where are we going to get this money from? How, what are the financial mechanisms to actually get this money and implement it from the national to the provincial level? I used to do what I would call the Sheetal Roadshow, and I used to go to all of the provincial departments to meet with the heads to understand the data. I had a whole lot of messy data, and I wanted to know, why didn't cases go up there? Why is there missing data here? What are the patterns? And understand the meteorological impact, the entomological data. So it was a very it was co-creation. That's actually a term that I would use to describe this co-creation of these models. And so what resulted in the end is that when government took these model-based insights forward to the National Treasury to ask for the money, the Minister of Finance allocated 320 million rand for the malaria work that was due entirely to model-based insights. And to take it further, the WHO further awarded the country in 2023 it was a sort of they gave the country, the Department of Health, an award because of the strength of their investment case that resulted in these in these novel interventions. And something to mention here to inspire PhD students is that in working with government, I was simulating a range of scenarios to understand, what could we do to achieve malaria elimination in the model using all of the data and their insights, and I could not find an answer. Nothing we could do could eliminate malaria because we have a very large proportion of imported cases. And so I said, you know what? The major PhD finding that I had in my academic work was that we had to do what you'd call source reduction. You'd have to go to the actual sources of the higher prevalence areas and help reduce malaria there, which would then in turn benefit the country in reducing the number of imported cases. Now that sounds like an obvious thing, except that how do you spend domestic resources? This is where the finance became really important, is understanding money flows, and South Africa gets malaria budget from domestic resources. We don't get international donors, right? So it's the National Treasury who gives us money. How do you take taxpayers' money and go to another country and solve their health problems? You see? And so I thought nobody would accept this particular recommendation because it sounds so academic coming out of a PhD, that actually I think simulation is showing that this is going to work. This is the only thing that will reduce our malaria to the point of elimination. And I took it to government. And would you believe the National Treasury thought that it was an excellent idea and committed another, I think it was 22 million rand or something, even a bit more, to source reduction in another country. And that is inspiring because it's academic work having, creating further insights into real life modeling, which then actually led to actual decision making to support public health.
I mean, I don't have words. That's so impressive. Sorry, maybe it's just But you're talking of all these things, and I'm just picturing you as the PhD or straight or fresh out of the PhD, and you're going into this world. First
Yeah.
of all, understanding policies, understanding government structure. I'm just thinking, yeah, that sounds intimidating. Was it like
Yeah.
how was it frightful? How did you obviously it comes with experience, right? Dealing with these kinds of structures and people and
It
was there
does.
something that oh yeah,
Yeah.
so
I mean, it's hard to say it comes with experience. I mean, it does come with experience, but as you said, I was fresh out of a PhD,
yes.
right?
So what I
So
mean, was
it's
there a
kind of this,
textbook how
yeah,
to deal with
inception by
government in your
fire.
did you take a
Um,
course in political science or what did you
yeah.
do?
I'll tell you what I took a course in that actually I think is what
Hmm.
allows me to think so sort of holistically. In operations research, one of the courses we teach at UCT is called systems thinking, and there's a field of system dynamics and thinking and basically understanding that the system is more than just the sum of its parts and understanding all these different flows. So the first so in that is what I think enables me to realize that I'm not just modeling malaria transmission, I'm modeling a public health system that is a function of the government supplying the where the money is coming from, the patients and their characteristics, the facilities and the infrastructure, the data and reporting systems. All of it together is actually what I'm modeling. And once you accept that, you realize that that's when you can realize you can solve public health problems. Otherwise, you're solving a disease problem that is not necessarily feasible in the real world.
Hmm. But I mean still, going to that first meeting or sending that email, it's really putting yourself out there. Is
Yeah.
that something that you would recommend to young people or like take that chance? Uh, what's that saying where they say, fake it till you make it? Not that you fake it, but I mean, like,
It's more a leap before you look. I think.
yes.
I think it's so. I would actually characterize it slightly differently. It's the quality of tenacity.
Hmm.
And I tell my students this that I actually call it Africanacity. It's us making a plan as
Hmm.
Africans and realizing that so it's about recognizing Ubuntu, and that we're all trying
Hmm.
to solve public health problem, or in my case, public health problems together. But it also comes with humility. So it's tenacity with humility, Stefan. So you don't go to a government agent and be like, I'm going to show you how to do your job because I'm clearly the clever person with a PhD. No, no, no. We have so much to learn. And that's why whatever we do is in the spirit of co-creation with mutual respect and a
Yeah.
recognition of different types of expertise.
Hmm.
So yeah,
Yeah.
tenacity with humility.
Okay. Yeah, no, that humility I think is very important because you never know it all. And I think especially for us South Africans, we are so ignorant of government because of the negative stigma in government. So we just think government doesn't achieve anything. But you can obviously, give experience of or tell stories of where, you've seen very, good work, for example, or, because they've allocated the correct funding to your projects, to solve real problems and it works. And so obviously you've seen this, but I guess for a lot of South Africans,
Mm.
I think this is kind of a blind spot for us.
Yeah, no, I do agree. And it's easy to stand on the outside and throw stones,
Yeah.
and just to accept whatever the media says to frame one's view.
Being,
Or you could
mm,
provide support and you get into different levels. And it's not that there aren't problems. Of course, there are problems, but there are also very good people at government who are working to make the country a better place. And so you need to explore different ways in which you can help with our incredible skill sets that we develop as part of our programs across the tertiary institutions in statistics.
yes, and it's someone I had a manager once that said, "Don't ever just point out a problem, but give potential solutions as well."
Yeah, yeah,
And that really stuck with me. And maybe sometimes I don't always do it. You know, you go into meetings and you kind of vent a little bit, which is sometimes good for your soul, but in general, you know, be part of this. And I think in South Africa, we have so many opportunities to mean something to someone.
Yeah.
I've worked a little bit in overseas, and you know, the first world where everything is so perfect and solved and everything is done for you. I've really noticed that a lot of people, they want opportunities to mean something, but they don't get those opportunities.
Yeah.
So that's where they
Yeah.
go to Asia and Africa to mean something. So I think for a lot of young people that may be thinking of leaving South Africa, I mean, go do your thing, but realize, come back,
Come
mean
back.
something. Yeah.
Yeah. Yeah. Absolutely.
Thank you. I really enjoyed that. So, can we talk a little bit? I'm very curious.
Yeah.
So can we talk a little bit about MASHA, like
Yeah.
how it started, or was it a brain child that you had, or how, you know, did someone plant a seed? Can you
Sure.
elaborate a little bit?
Yeah. So, the actual, I never wanted to run a whole organization. I was nervous to do so, not because I didn't know how to do it. I thought it's quite, easy to run an organization, but I would have to be responsible for a lot of people's salaries. And I thought, well, how can I employ people? Where am I going to get the money from? Where's the certainty in employing researchers and administrators and managing and giving people contracts for years and years? Where will I get this money from? It's a very uncertain world to live in, a soft-funded research space.
Yeah.
And so because of that, I wasn't always keen to start a research institution. I thought I could survive as a single academic researcher, in my department. But then as I became more and more exposed to the problems that needed to be solved. I started my work in malaria, so looking at some of those big malaria problems and where the grant funding was coming from, I realized that in order to apply for these big international grants, grants from the Wellcome Trust or the Gates Foundation, I needed a team. I needed to actually build something. But then it's a chicken and egg story. Where do you get the money to build a team? So my first award actually was a Wellcome award. I'm really grateful to Wellcome for supporting my research since then. It was in 2018. And it was all about building tools for malaria decision-making support in a range of countries. And it allowed me to start MASHA, to employ researchers, 3 or 4 researchers, an administrator. And what I'm additionally grateful for is that particular award was 10 million rand. And I was like, wow, that is amazing. I mean, of course it's amazing. It's a lot of money. And we really made it work. And there again, I think is where, the Africanacity comes in, is that we can make the money stretch. And stretch we did. we extended that grant for beyond 2 years because in the middle of it, COVID happened. And that's when it was the scare for me for COVID was that we were suddenly required to do, asked to do COVID modeling. So this comes back to your previous question. When do people ask you? I got a call from the National Treasury to say, hi, you made a malaria model for us last time and it was great. Can't you make a COVID model for us? So I was like, yeah, sure, I'll do that. 2 years later. And so the question was, my staff are only funded for malaria. How will they be funded for COVID? And I emailed my investment managers at Wellcome and they said, yes, that's fine. You can pivot your grant from malaria to COVID. You're doing the same methodology and thereby support your staff. And we'll even give you extra 6 months of funding because so that you can support your staff. And so that's basically how MASHA started, and how we were able to get into that. It all became so rapid. We started in April of 2019, and then March of 2020, we're asked to move into the COVID space. So it was a rapid birth of the organization.
I guess COVID for a lot of people, obviously it was terrible, but it caused a lot of opportunities as well. And good things came out of it.
Yeah, no, absolutely. Not by any way minimizing the devastation that was
Mm.
caused as well. I mean, I'll say this for my team and myself. For me personally, it took 2 years of my life, every weekend, every day, pulling all-nighters every second day because that's the urgency of the situation. And my staff were with me throughout it. We never had time to bake bread and make dalgonas and follow the trends that were happening in as during
Banana bread.
lockdowns and all of that. We were in a very different stressful situation to help support decision making. So I'm very proud of my team for that.
Yeah, I mean, the public or outside, you see the success, you see the flashy, grants, but you don't see but you mentioned those weekends, those incredible hard work. So congratulations, you really, really deserve it. So we're kind of going towards the end, quite a few things that we've discussed. But I'm quite curious, because this is I think we're in a very interesting age for the field of statistics and modeling. And so that for a lot of people, the foundation starts in undergrad. So I think we mentioned this very briefly in the beginning. And I wanted to quickly talk about this and then we can end the discussion. So especially what you said in light of, the data sets, the life skills that you're looking for when people apply as candidates for the center. If you could redesign the introduction statistics course for 2026, how would it look? Would it look very different to what it's currently being taught? Not in detail, but just more or less.
I think I would add a very large EDA component and of data sets, as in it's good that first year is all about let's introduce distributions and understand hypothesis testing. But what I found is when I get to supervising at the master's level, the EDA is weak. Students, they don't understand how to gain information and tell a story out of data, how to actually it's not as simple as let's just run every univariate graph and every bivariate graph, because unfortunately that still happens, but that is not showing insight, it's not showing a process, sort of thought flow. So I would imagine that actually one of the best benefits we might get is if we dedicated even like a semester course to EDA, to the management and handling of data, the cleaning of data, the understanding of data in the real world versus academic data sets, and how we get information out of that in terms of being able to direct it to the types of analysis. We do not need to explain what longitudinal data analysis is or multivariate data analysis. You can do it in words. By explaining, well, actually, hey, look, maybe we need to be, understanding how each of these variables, are contributing to multiple, multiple outcomes, for example, as opposed to saying we must do a multivariate statistics group or even cluster analysis. These things can be understood, and explained quite easily to first years as concepts, and then from second year we actually move on to the or either later in first year or second year we move on to the theoretical foundations of statistics. Otherwise it is quite an abstract start, and I just don't think, because we start with distribution theory and so on so early, I don't think our students get enough practice of what is real world data by the time we expect them to be able to do these things at master's level.
That's true, because in my experience also with undergrads, they miss the big picture.
Yeah.
Like you start too theoretical and they have no clue actually how this is applied.
Yeah.
So if you give them the story first and the implications of the story and how you can create the narrative, okay, now you move on and say, okay, remember that narrative?
Yeah.
Let's start looking at the technical aspects now.
Yeah.
And that's so, but obviously redesigning an entire course, I'm not sure how feasible is that for a lot of universities, but I guess you can add smaller components and assignments into courses like this. Now, I'm like that you say this because we're trying this also now with some of our courses here at Stellenbosch, where we give these essay type of questions. where it's like, okay, here's the problem, here's a potential kind of data. Just explain in words what you need to do. And that's part of exams. I mean, it's you can't do essays with LLMs and get an answer.
Yeah.
They need to sit and examine, right?
Yeah.
Okay. No, I really enjoyed that. Thank you. Sheetal, thank you so much for your time here. I hope the community will like this. I've learned so much. I mean, I have no idea how it sounds like you are stressed really thin.
One way of putting it, yeah.
Okay, but really, thank you very much for your time. I really appreciate it that you are willing to come to the newsletter. Also, I hope the viewers will enjoy this. But yeah, and then good luck with all the rest, with the funding and managing it all, and all the best for your future, for MASHA and for you and your future endeavors.
Thank you so much, Stefan, also for having me on this as a part of this interview series. And I really hope that a bit of this is able to inspire our students in statistics to, one, come through and do your postgraduate degrees, but also, more importantly, use the skill sets that you have acquired over your undergrad and postgraduate degrees to make a meaningful contribution to the world. Thanks.
Awesome. Bye.